Oh, how long it's been since I've seen your face. You're gorgeous, you're beautiful face.
Wow. Impressed. I was not expecting that.
Thank you. I am taking donations if you would
That
like
was
to.
pretty good. That was pretty good. I like that. Oh my God.
Thank you.
Wow.
Welcome to Getting Juicy, the musical.
I am absolutely speechless after that. You're more awake than usual.
Yeah, I am actually. It's nice and sunny in Vancouver, and I'm not going to mention anything more than that. It's nice and sunny.
Same here. Same here.
I know. You look good. Your face looks lit.
It looks lit, yo. You mean like lit as in like lighting, or is it
both?
Okay.
No, lit like it's on fire.
Hey, okay. If you're lit, this is like me being. I'm showing my age now. What does that mean? Does that mean you're drunk?
No, I think of lit being
like you're awesome.
Like it's on fleek.
Okay. Well, because I thought that also. What's another terminology for like you're hammered?
Oh.
But I mean, isn't there a newer one? I thought it was
smashed.
Wrong person to ask. I just realized.
Yeah. You gotta ask my boyfriend.
Never mind. Because it seems like the past few times we've had our interviews, we're almost cutting it short with our introduction. So I'm going to introduce our guest right now. Yes. Already, in case she pops on a couple moments early. Our guest is actually my naturopathic doctor, whom I realized this morning. I was like, is this kosher? Because I mean, she knows a lot about me, which I have no problem talking about those kinds of things. I mean, but on the flip side, as a professional, I wonder how open she'll be about talking about herself.
Right.
And she'll watch this introduction. She'll be like, "Oh, Rachel, it's all." Maybe she'll be like, "It's all good." But anyway, it's just something I thought about, like patient doctor confidentiality, and it kind of goes back and forth with the doctor as well, right? So anyway, she's an ND. She's a naturopathic doctor in Kelowna, so up in the Okanagan area where I live. And she actually got her training. I mean, she went to UBC. She's from the Okanagan, wanted to plant her roots up here and have her practice up here, which she did a couple years ago now, I believe.
Right.
But she did her naturopathic medicine training, her actual certification to be one in Arizona.
Oh.
Yeah, so she went to the States, which is interesting. Like, I don't really know much about that realm. Is there other better schools there? Like, I do want to ask her why she decided to go to the States. She does focus predominantly on joint hormones, which is a big thing for me and for a lot of women, all women, I should say, and digestion. So gut health and those kinds of things. And she also has her certification in IV therapy. She does, which is a really popular thing these days, has been for a few years now, I guess. Acupuncture. So she does a plethora of things, but predominantly her focus is, I want to say more women's health, but she'll have to correct me on that. I'm not quite sure, but it just seems that way with hormones and, digestion. Everyone has digestive issues, I guess, but yeah, again, I'm preaching to the choir on that one. Yeah. But it's interesting to have her on because what I was wanting to maybe talk to her about as well is just the butting heads of the Western medicine and the holistic naturopathic medicine. Because, here and I, in a podcast episode many ago, I think we both were pretty open about the fact that we both take antidepressants. And that's not necessarily something that a naturopathic doctor, when you think about the quintessential doctor, would maybe agree with. Now, what I love about Brittany, and I just call her by her first name, is she has the best bedside manner, and she stays and sticks with you for as long. Like, she's been amazing to me. Like, I'll be there and she'll literally talk to me for as long as I need to talk to her about what's going on, and she'll really dive deep into the issues, but she also doesn't judge at all. So with that being said, she doesn't, like, if I bring up any kind of Western medicine practices or things that I'm doing, there's no judgment. There's no, like, you know, kind of weird facial expression where I've had that with other holistic practitioners in the past. She's wonderful. She's beautiful. So I'm really looking forward to having her on. Yeah. So I don't know, what are your thoughts on, I mean, I know you have a naturopathic doctor yourself.
Yeah, I do have a naturopathic doctor, and he actually would love to come on the show. So I definitely want us to have that, and I think it'll be cool to have two different perspectives that kind of compare and contrast what their backgrounds are, because I think they're quite similar in their non-judgmental and inclusivity of Western medical doctor principles and Eastern naturopathic doctor principles.
Yeah,
so I think that would be really, really interesting. My naturopath, Jason Marr at Evoke Life, he's really been an incredible fixture in my life. I actually didn't know this until I saw him recently for my blood pressure check and stuff, but he was saying that I was one of his first patients within his second year of practice.
Wow.
And I ended up meeting him because I was referred to him by a former friend of mine from when I worked at Y Yoga as a guest experience member, and we had perks and benefits of wellness discounts, which is really sick. So when I got referred to Jay and I met him, I just, like, one, I thought, okay, you're beautiful. Two, you're beautiful. And three, you must be talented considering I got referred to you. And check. And he helped reverse my leaky gut syndrome. He established my diet and nutrition that I've been following strictly for the last 8 or 9, I guess 7 years now. No, wow. 8 years. Because I had a leaky gut syndrome and also stage 2 adrenal fatigue. And I was going to eventually develop kidney, adrenal, not cancer, but basically adrenal failure, which would be stage 3 kidney disease.
Yes. I didn't know that.
Yeah, so it was really, really painful. Like, I remember my gut being so inflamed that because of all the depression I was feeling from the work environment, the corporatocracy, and being mistreated and just being taken advantage of and all this shit, and trying to be pushed out, basically. I remember folding over the desk when I was doing a cash out after an 8.5-hour shift at the desk, and I remember I actually felt like my entire system was shutting down, as if I was overweight again, and I had that the guttural feeling of, like, I need to lose weight because my organs are closing down on me.
Wow. Yeah.
Oh God, look at that gorgeous face.
Morning, you guys.
Good morning.
Good morning. You're already getting the hero treatment. Oh, look at your gorgeous face.
I love it.
I love it.
It's a good start.
Definitely. Rachel was saying so many beautiful things about you, and I'm so excited to finally meet you and learn all about yourself and everything that you want to share with us this morning.
Cool. I'm excited to be here. Thanks for having me.
You're welcome. So, and I just said, I'm like, I just call her Brittany, which okay.
Totally fine.
Okay, B.
God. And it's funny because I wonder if it's like a generational thing with doctors, because, you know, I have had naturopathic doctors and doctors in general who are a little bit older, and I would never feel comfortable calling them by their first name. Like, it's interesting, but
it is very interesting. Most of my classmates would go by doctor and then our first name. A lot of us don't go by our last name. It almost sounds weird when people refer to me as Dr. Jeffries, but I let it happen, but I prefer just to be called Brittany. It just seems more natural.
Right.
Perfect. Well, I was just saying before you hopped on, and then I always like to say to our guests, we are recording right away. We kind of do this fairly candidly. That's our whole shtick.
Love it.
So a little bit of an introduction to yourself before you hopped on. Now and I was saying and if you watch this, you'll see the intro, because what I said is, I'm like, I wonder if this is kosher, because I know there's patient-doctor confidentiality between you and I, Brittany, and I don't care to talk about whatever, but I realized, I'm like, otherwise you wouldn't have said yes to be on the show. But I'm like, I wonder if she's okay. Is that kosher that she talks about herself with me? Because I don't know a lot about.
Oh. Yeah, for sure. It's totally fine. And you're the one that acknowledged that you're the patient. So it's all good. We're good to go. And I'm happy to chat about whatever.
Okay.
Amazing. I mean, like, honestly, like, whatever goes, I'm good. So yeah.
Love it.
Totally. Rachel trusts me. And if you don't, then girl, we got an issue.
After 40 episodes now, I should think that I haven't shut off my screen yet on you.
No,
or You did you.
No.
That's awesome.
Anyway, so Brittany, yeah, so we just kind of mentioned, yes, you're in Kelowna. You're from Kelowna. No, you were born in Richmond.
I was born in Richmond, but we moved here when I was 5. So
Wow.
I grew up in Kelowna, and that's been home. So.
And you always kind of, you're like, this is where I want to plant my roots, not my practice is.
For sure. It was nice to leave. I went to school in Arizona, so it was nice to have that time away and really just like solidify that the Okanagan is where I want to be, and all my family's here. So I'm happy to be settled in and have my practice here. So
I was wondering why, well, first of all, just say, I think that your specialties or what you focus on, your focus has been predominantly hormones, digestion, joint health.
For sure.
3 like major pillars of.
Definitely.
Yeah. And then I also was saying like, you are certified to do obviously IV therapy, acupuncture. You've got and we've I was going to say you have a fucking massive plethora of things that you do. And what I just am so appreciative of you for is your like beyond unbelievable bedside manner, if that's how you want to put it. But you are just such a kind soul that will you're not just in that clinical sense of like, okay, this is probably what's wrong with you. Let's fix this. Okay, bye. Like it's so much deeper than that, which I really have always appreciated about you. So
thank you. And that's a nice thing with seeing a naturopathic doctor is we do have that time to make connections with our patients. And people really like that. I get to know you on a more personal level. It kind of builds a different level of trust. And it's nice to be able to have that different interaction and have time to have that different interaction with people.
Absolutely. But I don't think all naturopathic doctors are like that. I think
and that's the nice thing about naturopathic medicine though, is each naturopath is a little bit different. So you just have to find one that works with your goals and like your personality's drive and things like that. Because we are all just a tiny bit different.
Yes, absolutely.
It's true, because Rachel was speaking about the fact that, some naturopathic doctors can be quite stuck in their ways, funny enough.
Oh.
They're very much like, no, that's what you do. You don't take Advil, you don't take ibuprofen, like you don't do this, you don't do that. And it's just like, okay, whether the patient agrees or disagrees, it's really not your business to say what you should or shouldn't do. You can give guidance, you can give suggestions, you can say, hey, like this is what I've noticed in studies of how it's affected people's health or whatever Western over-the-counter thing might do.
Yeah.
But as someone like myself, I haven't had my actual MD for years. I've been using my ND because he's got Western medicine background and he could prescribe my medication. He supports my anxiety meds and everything like that. He can take my blood pressure. Like he can do anything I need that an MD would do. So why would I go to an MD when an ND can do whatever I need?
Exactly. And that's the nice thing is to find an integrative naturopathic doctor that can write prescriptions if you need to. I say there's always a time and a place. And I've had some patients that come in and their blood pressure's through the roof and, we can try naturally, but you do need a medication in the meantime while we change diet, while we change lifestyle and that kind of thing. So it's nice to have access to multiple tools and to just meet the patient where they're at. Sometimes they do just want the Advil or the Tylenol, and that's okay. I'm going to help you safely do that, and then try and convince you to switch to something else.
Exactly, right? Yeah, gain the trust and let them believe.
Absolutely, but that's so and it's over the years, and especially and Brittany, we've been talking about my skin stuff and all that stuff like that. Like just the butting heads still, and I wonder if you can speak.
Oh, yeah.
I mean, because we weren't going to maybe dive into this so quickly, but Hero brought it up. The butting heads between the Western medicine community and the naturopathic or holistic community is still, still there. And for example, I'm not to name names, and I do live in a small town, but I'll just say I did go to a dermatologist because I was just, exercising all my options and trying to just get advice from all walks of life and all walks of backgrounds of medical experience. So anyway, but of course, the first thing she said was Accutane. That's the only thing that's going to work. That's it. That's what's going to work. That's all there is. And then when I kind of brought up, well, what about any holistic? And she's like, no. And I was like, what the fuck? How am I supposed to? I don't know how to navigate this. So, like you said, like there is a time and a place, but I just feel like there still are people that just want to cut to the chase, prescribe, and then.
And part of it, I think, maybe I'm making excuses for them, but what I like to think is that's all they know. So they only know Accutane. They don't know the other side. They don't know maybe diet, maybe hormones, that kind of thing. So it's what they're confident in and what they know how to do, which is fine. There is a time and a place, again, for that. And there's things that a dermatologist does that you definitely don't want me doing. But we all just need to acknowledge where our limit is. And maybe instead of saying, no, holistic won't do anything, maybe just say, I don't know. And I think that's where the barrier and the clash is that everyone has a little bit of an ego and doesn't want to admit that maybe there's something outside their realm that they don't know. And for the most part, naturopathic doctors are fairly good. There's always a time where I'm like, I don't know, you need to go see your medical doctor for that medication, or I don't have experience with that. Maybe go seek help somewhere else. And I think that's where naturopathic doctors just have a little bit more of an advantage, as we can say, I don't know, and you do need to go seek help in the Western medical system. And then we can kind of work together. That's the ultimate goal, is to work together.
I feel like maybe your trainings are so different. Like your training, it almost sounds like there's a more of a softer touch or approach in a natural medicine training, and just how, I don't know if that's true or not, but I just get the sense. And
I mean, like, it is different, right? Coming from a naturopathic medical school is a lot different than traditional medical school. And obviously I've never been to traditional medical school, so I don't know exactly what it's like, but that definitely could be a valid point for sure.
Yeah. And so, and you said before, you said Arizona, because I know you went to school. So why Arizona? I'm curious. Like,
okay, so there aren't a lot of schools to choose from. So there's only 2 in Canada. There's one in Vancouver and one in Toronto. And then there's a few in the States. And in all honesty, Arizona just accepted me first. So I was like, oh yeah, I got accepted, and that's great. So I'm going to go there. And then I ended up turning down the interview in Vancouver just because I was excited for change of scenery, meet some new people, have a little 4-year adventure. And it was the best decision that I made. So it was worth it.
That's awesome.
And where in Arizona were you?
I was in Tempe, so it's just right outside like Phoenix and Scottsdale.
Okay.
Yeah, so it was good. The summers there are brutal, but the winters there are perfect. So
there you go. It sounds like Vancouver. Well, actually, the summers here in Vancouver aren't too bad, but yeah, I get that.
Exactly. It's kind of opposite here.
Yeah.
Well, isn't it kind of like similar to the Okanagan in the summer? Or it must be even hotter there.
Oh, it's horrible in the summer. It like can be legitimately 50 degrees. Like it's insane. You know, when you open the oven and like the heat kind of bursts out at you, that's what it feels like when like the sliding doors open at the mall and you go outside. It like takes your breath away. It's so hot. You can't go outside because it's so hot.
Oh my God, gross.
Yeah. Yeah. It was always sweaty. Everything's always hot.
Yeah. Oh.
Yeah.
So how did you, why naturopathic medicine?
Okay, that's a good question. So ultimately, I think it comes down to my grandma. She always saw a naturopathic doctor, and like a lot of people, I thought that she was crazy and it was stupid and that she needs to be more in the medical side of things. So I have been that person before. And I actually went to school thinking I wanted to be a pharmacist. I was very intrigued by how we could take a medication and it could change kind of like the biochemistry inside of our body. I found that very fascinating. And then I realized I don't want to be a pharmacist. They just count pills all day. Once you finish school, that's kind of the extent of it. So Dr. Spooner, actually, from Vernon, the clinic I was at in Vernon, he did a presentation in my pharmacology class at UBCO. And I thought, like, wow, this guy's a genius. He was talking about bioidentical hormones, and that really just triggered that natural things can also change the way that our body works, and maybe in a different, more natural way. And so I looked into it, and I realized naturopathic doctors are legit, and they know what they're talking about. And then I applied like a couple months later. I'd never been to a naturopathic doctor. I just dove in head first and yeah, went for it. So it was kind of a good little accidental fate. And then I ended up working for Dr. Spooner, which was really nice to kind of work with the guy who got me into it. So.
Wow. Because that was going to be my next question was, have you been to a naturopathic doctor, or did you have someone? But instead of that, it was actually the person that educated you in your,
That's crazy.
in your teachings, which is just as powerful.
For sure, yeah. It was nice to hear him speak in a very technical term. You know, we speak to patients in a different way than how I would speak to my peers. So it was nice to hear him have real understanding of things. And yeah, I mean, they asked me in my interview if I had been to a naturopathic doctor before, and I said no, and they were kind of shocked by it. But that was okay. It all worked out, and here we are. So,
well, in some ways, though, it's like, you know, I mean, I don't want to draw it the same way. It's like, oh, you know, if someone wants to be a yoga teacher, it's like, have you been to a yoga class before? And they'll say no, and you're thinking, not that your yoga training really teaches you about yoga, but at the same time, so that's what I find really great is that with naturopathic and with the school and the connection they had to you, they said, well, who cares if they've been to a naturopathic session or not? Like, they clearly have a knowledge and a baseline of what they want to do with it. They know what's interesting, and they get to kind of mold you in a sense. And then you could say, well, I don't want to be molded. I'm going to just follow the education, and then I'm going to do me.
Exactly. And that's exactly what I was going to say is I had no influence of how I think a practice should be run or how patients should be treated. I got to come up with that on my own. Which is nice. And now obviously I talk to my colleagues and see how they do things. And I'm sure that shapes me a little bit, but I got to start the foundation of my practice, how I want to be.
Yeah.
That is insane. Not insane. Like insane as in, I don't mean like as in actually crazy. Just
yes.
Sorry.
Yeah.
It's a little crazy to just jump in blind, but
well, you know, it's kind of like the Legally Blonde scenario. Like, oh, I'm going to be a lawyer just to get my boyfriend back.
Exactly.
And then, you know, then all of a sudden, like, you got like extraordinaire, right? So
yeah.
I love that. Oh, I love that Legally Blonde scenario. I love that.
I just watched Legally Blonde recently. Actually, that's so funny that you bring it up.
Yes. Oh my god. Early 2000s for the win.
Real. So, and I think, I guess my question was there, because I think some people will go into professions because they were dealing with something like health related or themselves, and then they decide to get more educated on that topic, and then they're like, oh, okay. And that was like me with yoga. Like I needed the meditation and all those things for my mental health, and then I thought, oh, I can do this to help other people, and this is great. So was there any of that at all, like even with pharmaceutical or any?
So I was completely fine. I do have Crohn's, and that did develop while I was at school. So it was nice to then have that education and kind of dive in. That's why I like to treat digestive complaints, because I'm very confident in that area, just because I've experienced myself. But I didn't have anything wrong with me before going to school. I wasn't on any prescription medications. Honestly, I didn't really take supplements. I didn't really do anything. Yeah. So it was nice to then kind of learn and try things for myself, to see and just how I convince myself that things are worth it, why you should take your vitamin D and why you need to do all of these things. I can then relate better to my patients. It's like, I used to be in your position where that wasn't something that I believed in, and this is why I've changed my mind. This is the research behind it and all of that. So I'm happy that I do have my naturopathic background for my Crohn's, just selfishly for myself, but it wasn't there before, so maybe school gave that to me as a little hint of something that I can focus on in the future.
So just to clarify, are you saying that you weren't aware of your Crohn's disease prior to going to or learning about it in school?
Yeah, so I was totally fine, and then school, I think it was just the stress of school probably that triggered it. I do have a family history of it, so it wasn't surprising to any of us. But yeah, I was in my second year of school when I finally got the diagnosis of what was going on. Okay. And interestingly enough, I actually was taking my gastro courses at those times. So I could jump right in and experiment right away. And maybe my gastroenterologist didn't love that, but she's come around to it now. So
wow.
Well, maybe like learning about it was like, because you're like, oh, I have those That's very, yeah. I think that's me, or
For sure. And I can just relate to people better. I know what it's like to have stomach pains or whatever it is, right? And so that's why I like to treat digestive patients is I can empathize with them. I know what is going on and I know those struggles, and I know what it's like when you try something for 3 months and nothing changes and you have to try something else. I know that frustration.
yeah.
And I can apply that to other patients as well. So I think secretly it's been a good thing for my career to shape me into a better doctor.
Yeah, it's like here, we always kind of do this. I like look at here, I'm like, were you going to say something?
Yeah.
And I'm looking at the wrong direction. Well, for Hero and I, we talk a lot about mental health on this podcast. And just because it's a struggle that we both have shared throughout our lives. And it's something that, I don't want to say it's something we'll always struggle with, but, to a certain extent with not just, the outside atmosphere of affecting or causing the anxiety, but also like intergenerational and DNA and like brain chemistry and all that kind of stuff. So, yeah. So because I have talked to you about my own anxiety, but is that something that is that a topic in your practice that you?
So honestly, before this whole world pandemic, it would come up every once in a while and we would chat about it and try and address it. But basically every single patient that sits in my office now has some sort of new underlying stress, anxiety, depression, whatever it is. So it has just kind of by accident, I guess, become something that I deal with more often. It wasn't something that I came out of school and was like, I'm going to do mental health. This is going to be my focus. But now I'm realizing everybody is struggling with something to some degree. Some people handle it very well. Some people are very, very extreme in their sufferings and they need a lot of help. Mm-hmm. So it has become something that I look at in everybody. And it's just scary and sad to see how much everyone is struggling.
I'm going to say again, it's insane because it is insane.
Yeah, it is.
It's unprecedented for our generation. There is a small amount of population that is still alive right now that has been through several pandemics or epidemics, and they might say, yeah, this is different from anything that's happened before. But at least they have a little bit of conditioning. But for people in our generation, and Britt, I'm just going to assume that we're all within the same kind of 5 to 10 year range, just based on my gauging here. So I can imagine for all of us to go through this, I mean, in different realms and specialties or professions. And I mean, Rachel and myself kind of have a similar, I don't know. My point is, I think Rachel and I have a similar background in terms of the people we might be around or exposed to in our professional settings. Maybe a little bit less for you, Rach, because of just your current situation and where you're in with what you're doing for your profession, and you're more in a remote community, whereas I'm with the general public a lot and less than a lot of people in my circle, but still more than some. My point being is that the situations we're being brought around with people and the clients that you might have now, what are your experiences with their mental health? And does that, where have you found yourself coming up in no resistance, but in a sense of like, I don't know? Because you mentioned this in the beginning of our discussion, like, I don't know. What are some resources and some tools that you might provide within your skill set to those people that have seen you for years maybe, and they are looking to you as like, you have the answer? How do you navigate that, besides saying it's not in the scope of my practice, but I can refer you to these people that might help you further from my expertise?
For sure. So I always make sure that a therapist or a counselor, somebody else is on board. And I think that's a really nice thing with our generation is we've kind of normalized that. It's normal to go to therapy. It's normal to seek help. So that makes it a lot easier to convince people of our generation. The older generation are still very hesitant, like, oh, wait, no, there's nothing wrong with me. I don't need to go to therapy. But that's not the point. They have a lot of tools to kind of help you with that. I always encourage, meditation, deep breathing, all of that kind of stuff. And then I will look at the foundations of health as well. What does your diet and your lifestyle look like? Is it fairly okay? Perfect. That's fine. There's no massive diet change I'm going to be able to give you that cures you and makes you better and has no more stress and anxiety. But if you're drinking 7 cups of coffee a day, maybe we need to dial that back. Maybe we need to look at the supplement regimen of what's going on. So I do see that quite often is maybe you're taking too many stimulant supplements. Trying to boost your cortisol and all of the good things that you think are proper, but in your current situation, they're not. And then I do recommend oftentimes supplements to just help in the moment. So they're not treating the cause of your anxiety. They're not treating the cause of your stress, but they're helping you just manage those symptoms in that moment, so that maybe your deep breathing can kind of settle things down completely for you, or that meditation can settle things down, or the treadmill sprints or whatever you decide is your kind of release can kind of settle you down. And then medications if we have to, but obviously that's, in my world, a last resort. And usually if it does come to medications, I do send them elsewhere. I'm very comfortable in the supplement world for stress and anxiety, but medications, I only do it if patients have been on it before, is kind of my rule that way.
Yeah.
So it kind of comes down to each individual patient you have to treat differently, and you have to figure out if they know what their triggers are and if they don't. So, you know, a lot of people now are having more of a social anxiety. Okay, so let's try and get to the root cause of that. Let's deal with that. Some people, their job just sucks and they're stressed all the time, and that's where they have to work. There's no other option. So we have to kind of symptom management that person, right? So everything is a little bit different. Mm-hmm. We try and find that root cause, but a lot of times it's just environmental that is causing that. And sometimes we can get rid of it and sometimes we can't. Sometimes it's a hormone imbalance, but those are more people that have struggled with anxiety or depression kind of their whole life. Those oftentimes don't just pop up.
Yeah, no, Rachel.
Hands up, baby.
Absolutely. Stroke of the hair. Yeah, like definitely chronic anxiety. And I also live with nonverbal learning disorders as well, which is kind of an interesting department because it's not necessarily anxiety and depression related, but I have those too. So
for sure,
it's interesting to kind of connect with people in medical realms and things like that, and they'd be like, "Oh, I haven't heard of that before," or "I think I know what that is," and they're like, "Oh, so you're on the autism spectrum," and it's actually I thought it was too, but no, I'm not at all. It's a complete different set of cognitive dissonance and dialectic incongruencies in the way that we interact with society and the world. And I've talked to Rachel about it on our podcast as well, right? So you can never judge someone by their exterior, and you also have to be aware of what they're talking, and you have to really listen. You have to really not just listen, you have to hear what they're saying.
Oh, exactly.
What they're saying, and every word that they give you is that little kind of discretion of, okay, this is going to help me understand how to address what my client needs in each moment. And if you don't, you could be missing some vital information of what they're trying to tell you and why they've confided in you to give you that information. Right?
Exactly. And it was interesting that you said that you didn't know either. You didn't understand. And that's where like patient education is really important as well, right? When someone is explaining, when your doctor's explaining what's going on, they need to explain it to you so you can be like, wait, stop, and have questions and really understand what is going on inside of you. And that was interesting that you didn't fully understand in the beginning either, which is extremely common.
Totally right. Yeah,
absolutely. And it's like, it's funny because when the pandemic first started and everyone that maybe has had chronic anxiety, like myself, like Hero, specifically with health related anxiety, like myself, you know, some of us were like, oh, we've been practicing for this pandemic, like, you know, in a sense, but like you said, I mean, there is another pandemic happening. It's the pandemic of mental health. And that's, you know, what people are starting to see, and all those, and maybe people always had underlying issue. I don't like to use the word issues, but underlying suffering or underlying whatever it might be with when it comes to mental health, but it just never really poked its head out until this happened, and we were all just kind of shooken up. So, you know, I can't imagine for you, like, you must have so many different types of walks of life now coming in with different.
Oh yeah. And some people are very stressed and worried about getting the virus. Other people are terrified to hang out with people because they don't want to give them the virus. Other people are struggling with social isolation. They used to be very social, and now they sit at home all day, and they don't love to watch Netflix like some of us do. And actually, I have one patient who recently went through a divorce, and so he is now used to live at home with his family and now is alone. And so that transition obviously sucks, plus throw more social isolation on top of it. And that, there's nothing I can do to change the social isolation in this point. So it's very symptom management in that case. But it's just really sad to see how everyone is struggling. Even if they seem like they're okay, they probably aren't. There is some sort of anxiety or some sort of stress or some sort of upset that they're not used to having. That is now there, and it is a second pandemic. I like the way that you worded that.
It is. And I just, one really quick other thing I'm just thinking of right now is, it's not like this is something that any of us were educated on. Obviously. So for someone like yourself, a health professional, during this year or so, have there been from your college or have there been extra courses or things that people are offering now for people in your realm just to deal with what's happening and with different things that are happening with your patients and those kinds of issues and new
things? For sure. So honestly, the medical profession right now has been difficult, whether that's naturopathic doctors, medical doctors, whether you're in Canada or the States. Yeah. Everyone has been kind of silenced on what we're allowed to say and what we're not allowed to say. And so the education hasn't been fully available to us, honestly, just because I think they want to keep our knowledge limited. So it's a lot of our own kind of dive into the research and that kind of thing. So it has been a lot of learning as I go. A patient comes in and has this new symptom, and it is a lot of, I don't know, give me the weekend. I'll do some searching and figure out how we can address that. It has been a lot of changes in even how I would treat someone who I've been seeing for a couple of years, right? That has Crohn's or that has acid reflux or whatever it is. There is now another contributing factor that I have to address. And the education is all just coming from myself and my peers and what we can find on our own. So it's a bit disappointing, but on the other hand, I understand sort of where we're coming from. Like it's a hard place to be in.
Do you think that the education system in naturopathy and other forms of medicine will adapt the curriculum after the pandemic has lifted, even if it's not until 2023 or whoever knows when it'll be? Because if you think about it, you're going to probably have a lot of people in these educational facilities that are going to bring it up. They're going to mention it. It's something it's not just going to be an elephant in the room. It's going to be something that we're dealing with our entire lives after, to make sure that it doesn't come back. So I can imagine the impact it has on the education system and revisiting manuscripts, revisiting curriculum and manuals or education texts and stuff, right?
For sure, yeah. I would like to think that it will change and maybe give we've learned it all. We've learned how viruses work. We've learned mental health. We've learned all of that, but maybe give more of an emphasis in some areas that weren't emphasized quite as much. Mental health was something we all learned in school, but you had to take kind of extra courses outside to learn anything above and beyond the basics, which now we're kind of all forced to do our own research and learn above and beyond. Which is good. It means that we can stay on top of the most current research and stuff, but there definitely is a hole in education that hopefully will be filled in the future.
So I just to go back to what you said, I'm shaking my head because I still can't get over when you said the word silenced.
Yeah. So we're not allowed to, technically I'm not allowed to treat the virus at all. Nothing before, nothing during, nothing after. I can't talk that with my patients. So we are limited to what we're allowed to do and what we're allowed to say. And the medical doctors, not quite as much, but they still are. That's why you find people that are kind of outspoken in the medical world right now. And they're very viewed as outspoken because they're going against the rules, essentially.
Interesting.
Yeah.
I did not know that.
Yeah. So, I mean, in the beginning, it kind of made sense. Like, no one's saying anything. We don't know what's going on. And naturopathic medicine is very fragile, I guess, in the media to begin with. So let's be careful. But now there's still a lot of hesitation and caution into what we do, which is difficult, but we work with it.
Mm-hmm.
Go ahead.
Cool.
It's like,
it's funny. We know each other so well. So I guess what I'm wondering then is that in terms of your client bases and so forth, how many of your clients have transitioned to being virtual as opposed to only in person? And
okay.
Has that been something that's been challenging for you to adapt to?
So most of my patients now come into the clinic. I do have some that I see virtually that are still nervous, but a lot of people just want out of the house and to have some social interaction. Social distancing obviously happens at the clinic as best as we can, and we're always wearing our masks. So people like to have just an outing for the day and going to talk to someone in person, just a little bit more personal. I'm sure, as you guys know, to have a face-to-face conversation is a lot better than to have a Zoom or a Skype message. So most of my patients come in, and a lot of my patients do get some sort of needle or injection, so they have to be in the office. But I still do telemedicine. It makes it a lot harder for me to connect with my patients. And to fully figure out what's going on. I can only see your head and your shoulders, and that's it. I can't do any physical exam. I can't really get to know you on that level. But obviously, I'm happy to do it for my patients. They need to get the care, and if that's how they're comfortable, 100%. But it was a weird transition to just like pop on a call and be like, "Hey, I'm Dr. Brittany. Great to meet you," sort of weirdly. That kind of thing, but it's the way the world is going, so have to get used to it.
You just made me think about, like, this is not a great thing to think of, but I wonder how many people have been misdiagnosed or through telehealth because, for example, like, I don't know, like, hey, look at this, or and a doctor being a little bit like, oh shit, like, especially in the beginning where a lot of clinics were closed for a while.
Exactly.
It's like, oh, fuck, well, I guess I'll prescribe you this. It should go away. Like, but I can't see it and feel it or, so.
Exactly. That it does take a little bit of an extra guess into what's going on, right? Like, think if someone sends you a picture of a rash, it doesn't look the same as when you see it in real life. Or if you can feel it. Is it soft? Is it bumpy? For me to push on someone's stomach, maybe they tell me the pain is by their belly button, but when I push, it's actually over by their ribs. Like, it does take out a piece of information that is beneficial. And so a lot of the times I will be honest with my patients and say, like, hey, this is my guess of what's going on. If you can come into the clinic, even for 5 minutes, let me take your blood pressure. Let me do whatever it is. And then I can send you on your way. It just gives me another piece of information to correctly diagnose. You're right. It does give a bit of a guess, and who knows if we're diagnosing correctly or not.
I absolutely.
Sorry, but so therefore, couldn't as the medical or the doctor, couldn't you also say as a disclaimer, if you are experiencing whatever it is you're experiencing, these are required to be in person?
100%.
Yeah,
100%. So a lot of patients still will try and be like, it's fine. I can just show you, right? It's just right here. It's fine. And then you have to have that discussion of, well, it's okay, but it's not perfect. And it would be different if we were still in that lockdown and that was our only option, but we do have a lot of protocols in place now. So let's try and get you in the door and do that. But
I want to kind of switch topics a little bit to injections. So IV therapy to all those kinds of things that, not to say it's a trend, but it has kind of, quote unquote, a trend for a few years now. And it's, it's like it's funny because I remember it was in Vancouver for quite a while. And then I moved up here 3.5 years ago. It was still kind of new-ish up in the Okanagan. So I guess not to be a skeptic, and I don't know, like, I just like,
be a skeptic, let it all out.
Okay. Because I know a lot of people still kind of think that stuff is a little bit of a hooey, or like, what are your thoughts when you hear people say that? Or even, we'll broaden this a little bit even to supplements, because that's all in the same kind of realm, really.
For sure.
Just getting it to the bloodstream or into the body much quicker with an IV or those kinds of things. But, once again, to the butting heads of the medical Western doctors and the naturopathic doctors and the, you know, even my doctor, whom I really do love, my MD. He's great. But sometimes he'll say, well, you know, they're probably just going to give you a bunch of expensive supplements that are not going to help. And you're going to spend like hundreds and hundreds of dollars a month.
Yeah.
So I know that's kind of a big question. I don't even know. Maybe it's more just, and
it's
you might.
Observation. It's an observation.
So, and I know you've done the training where that's not your thoughts, but what do you say to those people who are like, well, all naturopathic doctors do is prescribe you expensive supplements?
For sure. And that's extremely, extremely common. And I did even see that a little bit when I was at school. Our treatment plans would have like 10, 12 supplements because they were tired and they were stressed and they were anxious and they had knee pain, and we had a supplement for everything. And that just didn't quite make sense to me. And that's not how I practice now. I'm very big on, there's going to be some supplements based on what's going on that you're going to need forever. Right. So like with myself, with my Crohn's, there's probably supplements I should take always, whether I feel good or not. But then there's other times where you just need to take this supplement for 3 months. Let's get things back on track. And then you can ditch that. Then you don't need that anymore, which is how I like to go about it, is more short-term supplementation. And honestly, I try not to give more than 2, unless it's a really complicated case and they want to address more things than the main focus. I'm happy to give more, whether it's a B12 or a vitamin D or fish oil, whatever it is. But I like to try and keep it simple. But you're right, with the injections, with the IVs, with the supplements, a lot of times people don't need them. A lot of times people will come in with a bag of vitamins that they've been taking, and I'm like, why? Why are you taking all of this? This is wasting your money. Don't take those anymore. And so same thing with IVs. A lot of people benefit from them, but a lot of people also don't need them. So it very much depends on what's going on. A lot of people want to just try IV therapy, and great, let's do it. It's not doing any harm to you. As long as everything is okay, it's going to give you a good boost of your vitamins and your minerals and your nutrients and everything like that. And if you notice no change, you didn't need that. But some people notice a big change, and maybe it's their stress is really affecting them, or their metabolism is overly fast, or they're missing something in their diet, and you can kind of fill that gap. But it shouldn't be something that people rely on. You shouldn't rely on supplementation. You shouldn't rely on IVs. There's obviously a reason that things aren't functioning properly. So let's try and find that and make it a short-term treatment, and not every 2 weeks you need to get an IV type thing, right?
I love that. And you know what, I was just thinking, like, you know, we could say to the doctors, well, how about over-prescribing medications, right? I mean, there's always an extreme. Yeah. There always will be an extreme. And that is what I love about you too, Brittany, is because you've said to me before, you're like, well, you know, you could get it from here, or you could just go to, you get the same thing at, like, you know, whatever, Nature's Fair or some other store. It's going to be less expensive, and it's going to do the same thing.
Honestly, I keep maybe 5 or 6 supplements in the office, just ones that quality really matters, or the dose I can get higher as a professional brand than something that's available at a health food store. But otherwise, I just send my patients to Nature's Fair Choices, whatever health food store they want to go to. For a lot of the stuff, it can be a lot cheaper, and the quality can be just as good. I don't stock that much. I just have the things that are hard to find, or the supplements where quality really matters. So
you make a good point, right? Because, and for me, I definitely have always been on the minimalist side when it comes to anything. Not that I'm resistant to it, but again, it can cost quite a bit, and I'm not. I mean, most contractors aren't, but I'm not on a medical health plan. Like, I don't have any of those benefits and stuff. And so I'm thankful that my wellness team that I met through the yoga industry. And so they get that. So they are, like, my chiropractor is able to provide me a student rate, and my naturopath is able to provide me an accessible rate, which for me is still a lot of money, but at least if I need them on an emergency, or if I need them as a tune-up once a year, twice a year, I know I can go and I'm not going to feel stressed out. And so one of the supplements that I actually have been taking for, maybe for a year now, is actually just Gaba, because, you know, my naturopath was very into the Braverman theory and testing of the four main chemicals in the brain that are usually deficient and that are responsible for anxiety, depression, and other imbalances in daily living. So he's like, good, have you heard of the Braverman method? I said, no. So I took it, and then he said, okay, what were your results? I said, yeah, I'm very deficient in GABA, and I'm very proficient in this. And so he said, yeah, I knew that you're deficient in GABA. I know we've talked about it before. So here are two different supplements. You can get a third if you want, but the most urgent of all of them is just getting GABA tablets. And so I've been taking them for over a year, and they're just little tablets that you take. They actually taste really good, and it's definitely neutralized my nervous system a lot just by taking one supplement. It makes all the difference for me, in addition to my Prozac or fluoxetine. So,
and that's awesome, and that's good that you found just one thing, right? So maybe that is a long-term thing for you. Maybe it's short-term, but at least it's just one, and you don't have a cabinet full of 12 supplements that you have to take every day.
No, exactly. And it's like $25 a bottle for a month. It's pretty reasonable too. Whereas some supplements can cost quite a lot, and understandably so. They can cost a lot, and they're not sustainable to always have stocked. But Rachel, I don't actually never asked you. Did you are you taking any supplements right now?
I'm like, yes, I flip flop between sometimes I take, I take every night. I take magnesium every night before I go to bed. I don't know if it's a placebo, if it does help me relax and help me sleep. I'm not really sure, but I do take that. And then I don't take very many anymore, to be honest. And then I take vitamin D every day. So in the morning, vitamin D. And then I do take a little bit of iron when I remember, and I probably should be taking it more being a woman. And I know that I've had blood tests before saying my iron is quite low. But that's pretty much it. I used to take Thiamine. And Theanine for anxiety many years ago, but I didn't, I had such an extreme case of anxiety so many years ago that it didn't do anything. And at that time, I think I was trying to not take Cipralex or antidepressants. So I was like trying to supplement it with a supplement. So, and that just didn't work for me. But I guess with that being said, I was just wondering, Brittany, if you could say, and everybody's so different, every body is different. Obviously, we know all this. Everyone's brains are different. But if there's one supplement that's general that everyone should take, and I feel like I might know the answer to this, but what would it be?
Okay, typically it's vitamin D.
Yeah, that's what I thought.
What you're thinking. Yeah. So in Canada, actually, we barely get any vitamin D throughout the year if you look at the year as a whole. Just because of where we are. So maybe like June to September, you're getting vitamin D from the sun, but the rest of the year you're not. So very, very often I see patients are deficient in vitamin D, and it plays a role in a ton of body systems. We call it vitamin D, but it actually works like a hormone, which means that it works throughout the body in multiple areas. So it affects mood, it affects immune system, it affects metabolism, it affects energy, it affects a whole host of things. And I do see it low quite often. Kind of it's safe to low dose your supplement, your vitamin D always. If you want to do higher doses, it is best to get a blood test and see what that looks like. In BC, you always have to pay for it. So whether I order it or your medical doctor orders it, you have to pay for it unless a specialist orders it for you. Okay. So that's a little way to get around it. But otherwise, it's about $60. It's really great to have that value to know, should I be taking 1,000? Should I be taking 10,000? Should I be taking whatever it is, right? It's good to know what that level is for you, but I typically see that my patients are deficient in it. So that's kind of one across the board that most people need to be taking. Obviously, check with a healthcare provider before starting and before the dose and all of that. But yeah, that is the most common one that I recommend for patients, especially through the winter months here.
And then for anxiety, what is your kind of go-to? And again, I know everyone's different. Please, everybody go, like you said, go check with your healthcare provider. This is we're not here to prescribe anything or to give you, hardcore advice.
Exactly.
We're just having a conversation, but yeah, I'm just curious as to what.
I do really like theanine for people that have very situational anxiety. So they're nervous to get in a car. They were in a car accident a month ago and now they're nervous to drive. Maybe that's something that can just settle, take that edge off. So I do like that. Like you had said with the GABA, that's fantastic as well. There's a lot of, you can just get GABA on its own, or like a stress anxiety type formula will often have theanine and GABA both in there. Very settling. Magnesium, like you mentioned, again, very calming. The form of magnesium is really important though. So magnesium bisglycinate is the best to kind of settle things down and relax you. Yeah. Exactly. So that, and then hormones play a huge role too. It could be thyroid, it could be your estrogen, your progesterone, your testosterone. So we kind of start with the basics, and then if we need to dive into it more, then we look at the hormones. But oftentimes it is hormone related, and that's patient dependent how we treat that, whether that's with a medication or a supplement.
Of course. Yeah.
But yeah, you kind of mentioned everything that I would start with. The theanine, the magnesium, the GABA, everything has been mentioned. So you guys are all on the right track of where I would start, and then I would do further testing if any of those didn't really take the edge off.
I've never heard of GABA.
Yeah, so it's just like a feel-good neurotransmitter, essentially, that makes you kind of settle and feel happier and calm. So
interesting.
Yeah,
it's funny because like being on antidepressants, for a long time, fairly low dose now, but always wondering if, I know the brains of the different medical communities clash.
Yeah.
But I also wonder like if the actual medications clash with the holistic medications.
They do. Definitely. So serotonin syndrome is always a risk when you are on an SSRI. So oftentimes used as an antidepressant. Yeah. They do clash with some supplements. So if you are on medications, it's extremely important to check with someone before you start an anti-anxiety supplement, because they can kind of push you too over the edge. So that is very important to check. They do interact. That's probably the main interaction of medications and supplements that I see is the antidepressants and the anti-anxieties with the antidepressant, anti-anxiety supplements.
That's really important. Yeah.
What's interesting on that is that I actually did try it back in late 2013. I tried to taper off my fluoxetine and my medication after being on it probably since high school.
Wow.
Then I graduated in 2010, so kind of 5-6 years of being on it, and then on and off from there. And what I found really interesting is that my naturopath, and he was onto it for sure. He was definitely spot on with what he was suggesting. But he was saying, okay, so if we have you on this and this and this, then what he suggested was St. John's wort as a liquid dropper. And that's what he did. And it tasted disgusting.
Yes.
And it got more and more repulsive the more and more I took it. And then eventually I was like, I can't do this anymore. But I managed to stay committed to it as I tapered off the dosage completely, and then increased the St. John's wort, and then use additional supplements to try and balance it. But within the first month of my withdrawal from the actual medication that had been in my brain for that long, I became suicidal. I became extremely depressed. I cried every day. My sensations to everything around me was no buffer, and I had no ability to cope with the environment unless if I was distracted. And it was when I was doing my 500-hour yoga teacher training. And I can tell Rachel doesn't know this.
No, I didn't know any of this.
Why I haven't met you yet, actually. That's why. It's just before I'd met you.
Right, but we know a lot of... Anyway, continue. Yes.
So I remember waking up, and it was the fall, or fall-winter, which is even, of course, horrible for your mental health.
Mm-hmm.
Though I thrive in it normally. But I remember waking up and being like, and I've said this before, I can't inflict self-harm on myself or other people, so I'm kind of stuck with my brain, I'm stuck with my heart. And I can just remember waking up thinking, okay, just get to the training, get to the training. And then I remember we were in a class, we were doing a class, and it was all in the hips. And I know it's a generic statement of, the hips release emotion, but it's really the psoas. Basically, it's the psoas that does that. And so we did a lot of hip work and psoas release work. And I remember sitting in meditation, and I just started crying my eyes out because I was going through such withdrawal from my fluoxetine, and it was so painful. But I also let myself do it. Like I let myself cry and cry and cry, and it was such a release. And that's when I realized I can't I can't do this. Like, I have to accept that my brain needs this medication, even if it doesn't have to be the same dosage that it might have been from tapering off, which was 40 milligrams. So that, and I also had another 30 milligram medication that I started taking, which was meant to be short term, buspirone, and then I went off of that. So instead of being on 30 milligrams of that and 40 milligrams of fluoxetine, out of that whole process, I ended up going on to 10 milligrams of my fluoxetine, and that within 12 hours changed everything. And then about 2 or 3 weeks later, I started to feel the dip again. And then I said, okay, no, Jay, I need to go back to 20. And then I've been on 20 for the last, since 2013 or so, early 2014, I've been on 20 and I haven't had to go up at all. So that's what I find really interesting, is that coming from someone that's tried to taper off and then try to be stubborn and say, I don't need to rely on Western medication to be stabilized as a human being. No, because if I'm watching the fucking X Factor when it was on in this American version, and I'm fucking crying at everything like a pregnant woman, no hate or no shade at all, then there's something not going right in my brain here, because I'm crying at every single thing because I'm like a 5-year-old with no buffer again. So it's pretty fascinating when we talk about the crossover of Eastern and Western and the clash of it. But to be honest, sometimes, as you even pointed out, Britt, you need that. And that's okay. There's nothing wrong with it as long as you know what works for your body and you're not overindulging in something to mask pain. You're trying to get off of it, and sometimes you just can't.
Oh, exactly. And that's the perfect example of there's a time and a place for medications, right? You tried to come off it and you couldn't. And quality of life is important. Mental health is important. Your overall health is important. And you found a good dose that works for you. So why worry about that? It works, and let's stick with it.
Exactly.
Yeah.
Such a we should have another podcast episode on this topic. It's a very deep topic and conversation, because I've had a similar experience to you, Hero. And sometimes, I think to myself, it's not a good thing to think to myself. I'm like, if I never went on Western, if I never went on Cipralex or antidepressants, if I never did, but I continued to tough it out with holistic stuff, would I be in this position where I have a hard time? Well, I feel like I'll never be able to get off of it because the withdrawal symptoms and those kinds of things are so strong. I think about those things sometimes. But there was one time in my life, and I'm almost 10 years older than Hero. I've been on medication for longer than he has. But there's a time in my life that, yes, I went off. I've only ever taken one at a time. I've never taken more than that. But I was off for maybe 6 months. Actually, it was quite a long time for me. And I weaned off pretty good, actually, surprisingly. But I was in a pretty good place in my life. But then I went into a really bad place in my life, and there was too much shit going on. And everything just came back again. So it was just one of those things. But it's, if you kind of do research on people's withdrawal symptoms from antidepressants and those kinds of things, you wonder if people, I know that they do good, but I also wonder if it's such an addictive thing that, that's the reason why you're on it more than it. I don't know if you're trying to, I don't know what I'm trying to say. I don't know if you kind of understand what I'm saying, but that's because it's more, is it more that it's addictive and that's why it's you can't live without it? Or is it actually still doing something for you?
Chemically in the brain.
Chemically, if that makes sense. So that's, those things.
It's a chemical for the mental actual dissonance in our, I've said dissonance twice. I never usually say the word dissonance, but it's a good word to use in this context. But I can say, I can vibe for what you're saying. You're asking, is it the actual addiction part for having it so ingrained in us?
Yes.
Is it actually a mental deficiency in our chemical imbalance? And we actually need that to balance the generation of those chemicals to actually be so-called mainstream.
And that's where, unfortunately, there are no tests due to measure your brain chemistry, right? I don't know. I wonder, Brittany, is there anything like that out there?
So there is a urine test that you can do to look at your neurotransmitters, but it's not super accurate.
Yeah.
So typically what I see just clinically in practice is if someone can't wean off of the medication, or they do wean off and they feel worse off, then they are a candidate that needs it. If people can wean off, and maybe the weaning off sucks and it doesn't go well, but then they feel exactly the same once they're off, they were just addicted to it, and that's why the weaning off was terrible. So I kind of look at how you feel when you're on it and when you're off it. And if there's no change, that is not the cause of your symptoms. If there is a change, great. Then that's exactly why we have medications. It's to change when things need to be changed. So you really have to just look at the individual person and usually compare how they feel on and off. Weaning will suck either way.
True.
It will. And I think about when I chose to go off my medication in true hero fashion. I mean, and again, this is not private information, but like I lost my brother to cancer like 15 and a half years ago. And so I chose to wean off my medication at the most pivotal point. Because if I'm going to wean off my medication, it's going to be when I feel the worst, not when I feel the best. Mm-hmm. So I did it strategically in that kind of summer of like August, September, October. And I'm thinking, was that the smartest decision? It's not a judgment on my part, but it's just, well, there's no right or wrong time to wean off. But that's kind of when I decided I'm going to wean off at the hardest time, because that way it's going to be a true test to see if I actually do require this to stabilize my life or not, right?
Wow. I wish and that's the one part of medicine, I think, like the brain is still so
unknown.
So unknown, exactly. So unknown. Like it's actually unbelievable how after all these years of medical advancement, how we're still figuring things out about the brain and still don't understand so many things we don't understand about the brain.
For sure. And that's why there's so much trial and error. And I think that's why we call it the practice of medicine, is because we don't know. And so let's try something, see if it works. If it doesn't, we've learned from our mistakes, and let's move on and try something else.
Yeah, absolutely. Is there a realm, I know we're kind of getting to the hour already, which I can't believe it. Is there a realm of the body or of medicine and naturopathic medicine that you haven't quite tapped into yet that you're interested in, or that?
Ooh, that's a good question. I mean, honestly, probably mental health. It's just kind of brought light to me recently. So it is something that I do need to dive into a little bit. Obviously, I can manage the basics of things, but really diving in deep into that research is definitely something that I haven't done. And the gut brain interaction as well, to kind of pull it back into the digestive part of things, is we know that there's some sort of connection, but we don't fully understand that. And so maybe diving into that a little bit more and trying to make my own guesses of what those connections are would be something that I would focus on in the future.
Well, but that just ties into mental health too, because
for sure,
it's all connected.
All connected.
Yeah.
That's why, like, when you feel stressed, you get an upset stomach, right? It's all there.
It is completely. And where can clients find you? You might not be accepting patients in the interior health region, but what would you? How can people access your resources if that is the case?
So I do practice out of Vallejo Health Clinic in Kelowna. I can offer telemedicine to people that live within British Columbia. Again, that distance does make it a little bit challenging sometimes, but I can fill in the gaps when needed. And then I try and post some stuff on Instagram and on my website, on my blog and things like that. But if you guys ever have any topics or anything that you want me to talk about, I'm always willing to take those suggestions, because it's hard to come up with blog ideas and Instagram ideas and things like that. So if there's ever a topic that you want me to dive into, I'm happy to do that as well.
I love that. And you are taking new patients?
For sure. Yep.
Yeah.
Yeah, definitely.
Yeah. So, and we'll put all the information in our show notes and all that kind of stuff as well. That's good.
Cool.
And one of the last questions we like to ask our guests as well, because you're Rachel's guest, I'm going to ask it today. If you could be a kind of juice, not limiting to fruit, what kind of juice would you be and why?
What kind of juice would I be? I feel like the naturopathic answer is to say a green juice, but that's like stereotypical. That's what the answer has to be.
What kind of juice would you want to drink?
Because I love apple juice.
Aww.
It's just like brings me back to childhood. It tastes so good.
I love that.
So I feel like that's going to be my answer, is apple juice.
I love it.
Love
and
that.
Like kind of sweet, nice little treat.
Yes, and really nice when it's sparkling too.
Ooh, yeah.
Oh, I didn't think about that. Thank you again, Brittany, so much. I'm probably going to contact you for a B12 shot pretty darn
soon. You know where to find me.
Again, thank you for giving us your time this morning. I appreciate it.
Thank you so much for having me. It was great to chat with you guys, and hopefully we can do it again.
Absolutely. Yeah.
Good.
All right. Thanks.
Have a good day.
Take care.
All right, guys. Enjoy your day. We'll see you later.
Okay.
Bye.